it's OIV.
It's a little more right. Dr. Lawler, Commander of the U.S. Navy, retired. A lot of wonderful experience. Dr. Luongo, President and founder of the Partnership for Global Security. We're delighted to have you both here. And we'll call on you now in whatever order you choose. I think Dr. Lawler's name is first on my list, but it's really up to you to make an opening statement, and then we'll be happy to ask you some questions.
I think I've been volunteered to go first.
Okay, Doctor.
So, good morning. Thank you very much for the opportunity to speak in front of the panel. This is certainly an honor to be able to speak with you and to share my opinions. Those who know me know that I have many of these opinions, and many which are strongly held. And they're probably wondering what you were thinking, asking me to speak in front of you. But hopefully you'll find my discussion informative and helpful, if not provocative. So one of the virtues I hope that I bring to the table is, as someone who's had multiple different perspectives in the biodefense and health security community over the course of my career, as a physician, as a responder in high consequence infection outbreaks internationally, as a researcher, a laboratorian, and a military officer, and as a White House policy staffer. And I think in these roles I've had the opportunity to feel the proverbial elephant, as it's said, from a number of different angles and points of view, and from that hopefully have somewhat of a unique idea of what that elephant looks like. And I think that to continue on that metaphor, that elephant in the room is the fact that we are woefully unprepared for these biological threats, these transnational threats. And that as we continue to face a growing spectrum of these threats, both naturally emerging and potentially deliberate, we're also living in a world that becomes increasingly interdependent and brittle. And I think that the West African Ebola outbreak was an excellent example of that, where events that occur halfway around the world now have profound and very rapid effects in the United States and in other countries. So because I usually can't remember more than 3 things at a time, I've tried to focus on 3 areas that I think are problems that our national enterprise has to grapple with to be able to move forward in better preparing our country. And then 3 areas that offer opportunities for solutions. So the first of these problems that I'd like to discuss is our lack of threat awareness and our poor situational awareness as it comes to these biological threats. I think it's evident from Governor Ridge's description of intelligence assessments of state-sponsored programs that we often see a bouncing ball of these assessments in terms of one year is one country is a threat, another year is another country. And I think this reflects the fact that our intelligence community has yet to be able to figure out how to address the biological problem appropriately. I don't think that the IC has sufficient staffing of personnel who fully understand the sphere of biological threats. I don't think that the intelligence community has appropriately resourced its efforts against these threats and has not executed sufficient human intelligence and other intelligence activities to be able to have a really strong comprehension of what the threat space is for deliberate threats, both from state actors and non-state terrorist actors. More concerning to me is actually our lack of situational awareness in day-to-day health activities in populations, both domestically and internationally, as it pertains to potentially emerging deliberate threats, but also naturally occurring threats.
So, you mean on this one, to know when people are beginning to get sick?
Absolutely.
Yeah.
Yes, sir. So last week I was actually in Nigeria training hospitals to use proper infection prevention and control procedures to deal with the ongoing Lassa fever outbreak that's occurring in Nigeria. So this has been an especially bad year for Lassa fever, which is a viral hemorrhagic fever similar to Ebola, but there's an estimated 500,000 cases of Lassa fever in West Africa every year. It's a constant public health problem, but especially bad this year in Nigeria. These hospitals were very close to ground zero where most of the cases of Lassa have been documented. Nevertheless, these hospitals had never sent a patient sample for testing for Lassa fever because Nigeria relies on a centralized referral service for testing. As a matter of fact, the diagnostic capabilities of these hospitals was woefully insufficient. They had a few rapid tests for malaria, hepatitis, HIV, and a microscope to be able to diagnose some parasitic infections, including malaria, but really no culture capability, no capability to diagnose any viral pathogens. And this is not unique to these hospitals. This is true across almost all of the hospitals that I work in the developing world. The fact of the matter is that we have very little idea of what's making people sick in most of these areas of the world. And we have public health surveillance systems that have been set up to try and gather these data, but at the end of the day, if you're not getting information from the bedside, those collection systems don't necessarily give you much value. So we are in the situation similar to the old adage of a drunk looking for his keys under the street lamp. We only have a few street lamps that are illuminated in these areas of the world. And we are relatively blind otherwise in terms of what's going on day to day in these populations. I don't think that we're always necessarily much better at disease surveillance here in the United States either. Certainly on a hospital basis, we have much more robust diagnostic capability, but there's still significant problems in connecting the clinical world with the public health world. As a practicing physician, oftentimes it's very difficult for me to understand what other diseases are being seen in my hospital at that time, not even what's happening across the city or what's happening across the state. And to be able to understand those events in real time, I think, is critical to really being able to defend ourselves against what are rapidly emerging events. The second problem that I see in our national enterprise, to be honest, is ourselves. It's the government structure that has been established to deal with these threats. So in my time in the government, I can honestly say that I met some of the most intelligent and dedicated people working in this space that I've ever worked with. I will never doubt the people that we have in various agencies trying to deal with this problem, but they are stranded in a bureaucracy that is large, sprawling, and not necessarily organized in a way that gets them moving in a coordinated direction. They're hamstrung by a variety of different rules and regulations that prevent them from moving quickly. And as a result, our programs are often moving at a pace that fluctuates between excruciatingly slow and moribund. For a fun exercise, I challenge anybody at some point, if you're done with the Sunday crossword puzzle, to try and diagram the U.S. government civilian and military biodefense and health security enterprise, trying to find where lines of responsibility, authority, and funding converge. It is a massively complex system, which as a result, again, does not move quickly and is unable to be facile enough to deal with these rapidly emerging threats. I'm still witnessing repercussions and new initiatives coming out of policy discussions that I was part of 10 years ago that are now just coming to fruition, or issues have not been resolved that were decided upon 10 years ago. For instance, DOD had put out a memo over 10 years ago saying that naturally emerging and deliberate threats in the Chem Biodefense program really shouldn't be separated. We should be dealing with those together, and funding should be able to go between both of those. But we still run into problems with cooperative threat reduction programs and with the Chem Biodefense program, where program managers say, well, we can't do work on that agent because we only do select agents. That's what our task is. So the fact of the matter is that biology moves quickly. A single point mutation in in a genome, or another stochastic event, and all of a sudden you have a virus that's made a species jump into humans, and you have a totally new emerging disease threat. Influenza has a doubling time of roughly 2 days. So you're having exponential growth of an influenza epidemic over very short periods of time. And these events are happening before we can even get our pants on in response. We're never going to get ahead of the threat if we're continuing to operate on government time. My third problem that I think is pervasive often is the fact that we tend to look at these problems backwards, from a lens looking in reverse rather than looking forward. I think this is true in naturally emerging threats. We are often positioning ourselves and the enterprise to deal with the last threat. So dealing with the Ebola epidemic, or looking at how we counter influenza. All important, but it is likely that the next emerging threat is going to be something new and unanticipated. I think this problem is even more pronounced in the traditional biodefense community in deliberate threats. We still have a static list of threats that has been relatively unchanged for the last 30 years that dictates our requirements and priorities for countermeasure development. We base a lot of our assessments on threat, not only on former Soviet programs from the Cold War, but even our own offensive biological weapons program that we shut down in 1969. We seem to assume that our adversaries have not picked up a scientific journal since 1980. In the meantime, our threat space has grown tremendously in the realm of genetic engineering and synthetic biology. So my daughter is a high school senior. In her biology class, they were genetically engineering E. coli to make different colors grown under different conditions. This is something that 15 to 20 years ago would only be done in the most sophisticated academic research laboratories in the world. Now these technologies are widely available for kids to play with. It's great. It's wonderful in terms of the potential that's being unleashed for good, but there's also significant potential for malevolent use. Where are we going to be in 20 years from now? What's going to be widely available? Many of you, I'm sure all of you are aware of the recent development of horsepox virus being synthesized in a laboratory de novo. We have gene editing tools now that are able to literally rewrite the book of life. These are the threats that we're looking at. We're still pushing a wet noodle of a plague vaccine that we've been trying to develop for 20 years. We are not at a level where we're dealing with the threats of the future, and we need to stop looking backward. So I will stop my depressing rant now and move to the three things that I think are opportunities where we can move forward and we can improve. And the first is to simplify our organization, so how the government is positioned to deal with these threats. So certainly there are many state and local jurisdictions that have capability to manage these types of threats, but from a transnational level, we've ceded most of that responsibility to the government, perhaps without a full policy discussion of whether that was the right solution. But I think certainly we can streamline and make much more efficient the government organization that deals with the biodefense enterprise to make lines of authority, responsibility, and funding align with each other so that there are people who are truly accountable for progress. And that is, I think, a very important step that we can take. The second thing is that I think we need to look at how we can be creative in moving some of these functions outside of the traditional government space. I think we're in a situation analogous to many industries who, faced with these types of daunting problems, create a separate entity. They create a skunk works to really look at how they can be innovative and not harness to the legacy of the bureaucracy that's built up over years and decades. And I think that there's also an opportunity to move some of these functions outside of government so that they can be unrestrained, unconstrained by many of the barriers and the weights that harness our government agencies and don't allow them to move quickly. The second thing I think that we need to increase our focus on is in patient care. I was happy that Dr. Zucker specifically talked about patient management for quite a bit of time, and I think it's important to remember that our first line of defense and our last line of defense is often the bedside. It's actually what's happening with patients presenting to healthcare facilities or people in general individually. So I think that we have a lot of these programs that have environmental sensing systems and other more sophisticated tools trying to predict events, but ultimately I think the reality is that we're still going to detect most events because somebody develops symptoms, somebody gets sick, or a group of people gets sick, and that's going to be our sentinel event that really lets us know that something's going on. If we focus more on developing tools to recognize those events early and to be able to manage those patients effectively, I think we'll be much further ahead of the game. And that doesn't necessarily mean that we need to continue investing only in, the magic bullets of medical countermeasures, so specific vaccines or therapeutics that are targeted at specific agents. As I mentioned, I don't think we can predict necessarily what the next threat agent is going to be. And so I think we need to look at more innovative solutions at how we can address some of these patient management issues beyond just specific targeted countermeasures. And that brings me to my last area of focus, which is innovation. I think that innovation is going to be the key to moving us ahead and getting us to a point where we're much more prepared for these threats. As I mentioned, biology is by nature a nonlinear and exponential realm. And we need to think beyond kind of the linear approach that we've been using now. We're not going to be able to scale our way out of this problem. We're not going to be able to just do things bigger and faster and expect that we're going to be able to get ahead of the threat. I really think we need to look at innovating and doing things very differently. This means looking at new technologies, but it also means looking at new systems and new approaches. How do we think about the problem differently? For instance, in the patient management sphere, as I said, rather than looking at diagnostics that detect specific agents or therapeutics that treat specific agents, we should be thinking more about pathogen agnostic approaches. How can we exploit host immune response and other indicators to be able to quickly recognize disease, and how can we manipulate those to be able to manage threats that we haven't even necessarily specifically prepared for, but we at least understand the biology well enough to be able to manipulate host response and manage patients more effectively. I think the other opportunity we have for innovation is in the revolution of information science and big data and artificial intelligence. We have now remarkable abilities to manage and analyze large-scale data that we don't take advantage of in this space. We have, large electronic medical record systems now across the country that are treasure troves of data, both for research purposes and in real time to understand what's happening in the health of the community at any given time. But we have yet to fully take advantage of those to be able to figure out how we incorporate that into our defenses. So in conclusion, if you're the type of person who lies awake at night thinking about problems, I think this is probably one of the problems that you should be thinking about. But I think that we have the opportunity to move forward. I think the time for bold action was probably 10 years ago, but now is as good as we're going to get. So if we move forward now, I think we can make significant progress. But I really feel that we need to take the reins off the enterprise and focus on innovation to be able to catch up with the threat. Thank you very much.
Thanks, Doctor. I look forward to questions. Dr. Luongo, welcome.
Thank you. Thank you for the invitation to address the panel today. When I picked up your 2015 report off my nightstand, where it's resided for the last 3 years, I found myself in complete agreement with the first sentence of the preface to that report, which said, "The United States is underprepared for biological threats." And I think despite all the excellent recommendations that were made in that first report, as you just heard, the United States remains woefully underprepared for biological attack or the new intensity level which is occurring, I think, in the biological field. So I'm going to focus my remarks on 4 key issues: infectious disease and pandemics, emerging technologies, international threat reduction, and international institutions. Infectious disease and pandemics are clearly the most immediate danger we face from biological threats, yet the challenge is treated primarily as a medical issue, not as a global security issue. And within the medical community, it's not at all clear that we're ready to deal with effectively with the consequences of a severe infectious disease outbreak or pandemic. I just give a few examples. Earlier this year, we saw some hospitals were completely overwhelmed with severe flu and were stretched to their limits. So in Rhode Island, for example, hospitals diverted ambulances because they were flooded with patients. And in San Diego, one hospital erected tents outside the emergency room to manage the influx of flu patients. And this is an infectious disease that we prepare for every single year. So what does this anecdotal evidence tell us about our preparedness to effectively manage a bout of birds flu or swine flu, or emerging pathogens for which there are few or no medical countermeasures at the moment, for which the WHO lists Ebola, MERS, SARS, and other major diseases? I think there's several contributing factors to this situation. One is the increasing urbanization of the global population, not just in the United States, but around the world, and the potential stresses that a major outbreak would place on urban hospitals, some of which are not as well prepared as we are, obviously, in the United States. Another is a decline in antiviral and antibiotic research and development. The United States launched a national action plan for combating antibiotic-resistant bacteria in 2015, and this included the creation of a biopharmaceutical incubator, which is a good idea to promote innovation and increase the number of antibiotics in the drug development pipeline. But the timeline has been hazy, I think, as James just pointed out. This is something that we should have dealt with 10 years ago. This biopharmaceutical incubator, I think, has a timeline somewhere around 2020, and like most government things, probably will slip. But in the meantime, no new class of antibiotics has been developed since 1987. Antibiotic-resistant diseases are growing, and it's estimated that the global toll at present is several 100,000 people annually. That could reach into the millions by 2050. And while this is primarily an issue in a developing world, it certainly could spread into the developed world. Third, I think there needs to be better and more focused attention on the modeling of the potential spread of disease. This issue of big data and how we use advanced computing, I think, is important. Some of this is being contemplated inside the government, but it's not very effective at the moment or comprehensive. And finally, today, about 75% of all new emerging and re-emerging diseases are zoonotic in origin. They come from animals. So in our highly connected world, infectious diseases can spread quickly and far in a short period of time. Think SARS and H5N1 avian influenza and H1N1 influenza pandemic are examples of how quickly things can change and spread and create serious challenges in places, as Dr. Zucker said, where you may not be expecting them, but you should be. Compounding the infectious disease challenge is the rapid advances in technology. Advances in biotechnology, nanotechnology, and related disciplines pose a significant dilemma. The promise is of better healthcare and human health, but they can also be misused for hostile purposes. The field of synthetic biology in particular offers a number of challenges. It combines chemical synthesis of DNA with genomics to enable the rapid manufacture of DNA sequences or the assembly into completely new, unknown genomes. From a risk perspective, the ability exists to create new biological systems and organisms that can be used for malicious purposes. Much of this field, this is an interesting phenomenon, I think, that exists in a lot of these dual-use areas. In the democratic world, much of this advanced technology exists in the private sector. In the authoritarian world, it is controlled by the government. But in neither case is there very much transparency, either for commercial reasons or for secrecy reasons. So this raises questions about what is going on in the laboratory and how governments with control over the technology are managing it and for what ends. Major biotech countries, including the US and those in the European Union, have national frameworks and legal requirements governing biosafety and biosecurity. But the governance activities of other major biotech countries like China and Russia are much more opaque. There are also a few global rules governing synthetic biology activities. The Biological Weapons Convention obviously bans biological weapons. The Australia Group is an informal association that formed a synthetic biology advisory board in 2008. There's a synthetic biology code of conduct that outlines best practices, and that was driven in particular by concerns about the use of synthetic biology to create bioweapons and for bioterrorism. But the adherence is voluntary, and while it has some real value in terms of looking at databases against customer orders and then also making sure that customer orders are legitimate, it does not have the force of law. It's purely voluntary, and it's not universalized as well. While the governance process seeks to catch up with the rapid trajectory of biotechnology, the industry is undergoing additional changes, and I think this is a point that James made, which is that we're really behind the curve. So biotech is being significantly impacted by advances in data processing, artificial intelligence, and by nanotechnology. In the United States, the DARPA, the Defense Advanced Research Projects Agency, is looking at how synthetic biology can lead to advanced nanotechnology through a program called Living Foundries. The goal is to standardize and streamline the genetic engineering process so that it can more easily and inexpensively provide new materials, capabilities, and fuels and medicines that are built in a Lego-like fashion, creating these biological mini-machines. So while this may benefit the needs of the US military, it can also be replicated by other governments that may not have the same intentions that we have. In my view, as long as biosecurity regulation and oversight remains mostly national, primarily national, and globally uneven, the world will face greater biovulnerability. And as life science continues to advance, more transparency and oversight will become more important. One of the ways the United States and its allies have attempted to increase transparency at locations and in research has been through its threat reduction efforts, primarily the Department of Defense and the Department of State. A lot of these programs grew out of the old Nunn-Lugar program, which were focused on Russian and former Soviet states, but now we have no access in Russia, and they were looking at other opportunities. In particular, DoD, I think, is working in Africa. The Department of Defense's Cooperative Biological Engagement Program is really looking at global health threats and helping partner nations to improve biosecurity, biosafety, and also support the disease surveillance of traditional select agents and emerging pathogens. In 2014, I think this was also noted in your original report, the Global Health Security Agenda was launched with the goal of creating an international partnership that didn't just include governments, but also included non-governmental organizations and international organizations to strengthen the barrier against infectious disease and elevate global health and security as a global priority. The one important thing to note there is that while we, all of our European allies, our Asian allies, and China are members of this, Russia is not. And so what continues to happen in Russian biological research, I think, remains a serious question. I think all of these efforts are worthwhile, but I think they've also left a number of dark corners in the bio world unlit. So then it falls to the intelligence community to determine what activities are occurring in what countries, and countries like Russia, Syria, and North Korea. And here, I just would anecdotally note, about 10 years or so ago, a reporter for Science magazine was let into North Korea on a science tour. And almost exclusively, the North Koreans wanted to show him their biological research facilities. So I thought it was fascinating, since they have involved in chemical and nuclear and in bio. So we don't know exactly what is going on in all of these dark corners. Their biolaboratories are small, they're difficult to monitor remotely, and there's little of the large infrastructure, equipment, and signatures that are, for example, associated with nuclear programs. Historically, and in this regard, I really agree with what James had to say. Historically, the amount of intelligence community person power that has been devoted to this bio threat issue has been small. And while I haven't kept up with it in detail, it doesn't seem like it's grown significantly in the recent past. There are also challenges beyond states that are posed by non-state actors, including terrorists. State-supplied bioweapons to terrorists are one pathway of concern, but there's this growing DIY bio community, which I think has now spilled over apparently into the high schools. There's useful information, I think, from the National Science Advisory Board on Biosecurity regarding DIY bio, but that was back in 2011. In the meantime, terrorists have become more brutal and are better resourced than in the past. And Western intelligence agencies have stated that the Islamic State has been trying to develop biological weapons at its bases in Iraq and Syria. Syria itself is suspected of maintaining a biological weapons program. One thing I would say about Syria is that the trend is a little disturbing. So I think there's some uncertainty, as James said. One day the intelligence community says this country is a threat, the next year it says that country is a threat. I think it's pretty clear that there's some biological weapon program in Syria, but their unrestrained use of chemical weapons, their cooperation with North Korea on building a nuclear reactor, I think all of those things should give us a lot of pause about what's happening in the Middle East, and particularly in that war-ravaged country. Overall, I think that given the myriad international challenges that the U.S. government has had to deal with on a daily basis, and the lack of a bio attack on the United States has lowered the priority of bio threats in this country, and I think that that's a mistake. Finally, let me turn to international institutions. As the panel has earlier reported, and I think we just heard, the U.S. government desperately needs to get better organized on addressing and preventing bio threats. But the point that the panel also made in their previous report was that global prevention and response capability will not come from WHO at the international level. It will come from nations that agree to make it a priority. And then I thought there were some very, very sound recommendations about public-private partnerships and how to deal with this issue of not operating necessarily just on government time, as James pointed out. In my work in the bio area and in the nuclear area and other transnational security issues, I found that the challenges of the bio area are similar to those of other areas in terms of the transnational characteristics that identify it as a transnational challenge. There's a disconnect between governments and the private sector, which I think is something that needs to be remedied. There's an inability to coordinate effectively by breaking through silos as opposed to building silos higher, which is the natural tendency in governments, and particularly in Washington. And all of these issues are cross-cutting in the sense that they affect the economy, security, health, and human well-being. So my recommendation would be that as we work through each of these individual challenges, we should also identify whether there's a model that could apply to all of these transnational challenges that could help us streamline our approaches to them. So thank you very much.
Thank you, Dr. Luongo. Both excellent testimony. I note, and our staff, I'm sure, has noted too, that both of you stressed two things. One is documented or described and in our own way responded to in our reports, which is the lack of organization in biodefense generally in the U.S. government, probably a waste of money and probably a failure to spend enough in other areas results from that. But specifically, in terms of preparedness or detection, that we're not spending enough in the intelligence community on the biological threat. And I think that's something that we will take your warning on and focus on. On the question of surveillance and more than that, really early warning, we have looked at the BioWatch system, which was the domestic system installed in different parts of the country to detect a biological attack early on, and found it really wanting, really a waste of money at this point. We also noted, spent less time on it, frankly, but came to the conclusion that the Department of Defense has a better system for detecting biological agents that might be used against our troops in the field. And I wanted to ask you both whether you had experience with this, particularly starting with Dr. Lawler, whether our judgments on both civilian and defense are correct. And if so, how can we move the civilian expertise more into the, the defense expertise more into the civilian sector?
Yes, sir. Great questions. I think, first of all, for what it was, a system that was rapidly thrown together in response to a perceived emergency, and using the technology of the day, that the BioWatch system probably performed better than many people would have expected. But that being said, clearly it's based on very obsolete technology. There are many issues in terms of its ability to rapidly detect events and also to drive decision making, which is another issue in terms of how it connects with the public health community and how public health officials can make decisions off of that. I don't know that I would necessarily characterize DoD's environmental detection systems as better. Okay. I think there are some attributes they have which are superior in potentially their ability to characterize events and potentially sources more effectively. I think there are also drawbacks in terms of sensitivity that they have that may not be as good. I think what's clearly the case is that if we think that wide area release is still a significant threat on the civilian side, and certainly the consequences of such an attack would be so catastrophic that it's hard to imagine it wouldn't be worth investment, then I think we need to look at how we take what BioWatch was supposed to do, and it was my understanding that BioWatch was never intended to be a permanent solution. It was, again, a makeshift temporary solution until we could develop something more appropriate. And I think that the real question is, how do we create something that is much more up to date and much more nimble than what we have with the current system?
Can I follow on?
Please.
Yeah, BioWatch has been around now for 15 years, and we've heard this repeated refrain. Nobody thinks it was well-intentioned way back in 01 and 02 and 03, where 15 years later, we haven't had a witness or a soul that thinks it's even remotely effective, given the nature of the threat. What do we do other than complaining about it? And I mean, everybody in this space has concluded it is not what we need. 15 years worth of conclusions, but no single particular action. If you could wave the magic wand, what would you say? Or do we need a massive transnational pandemic to hit us that we didn't pick up, and by then we got thousands of people dead, and we say, geez, that BioWatch didn't work very well? What do you think? You've been inside of government and the military. If you're in the military, you get it done a lot quicker, wouldn't you?
Hopefully. I think that I would say two thare First of all, I emphasize, as I mentioned in my prepared remarks, that ultimately, I think that these environmental systems are always going to have their limitations. You're never going to be able to pick up, all potential attacks and scenarios. So I think we need to invest much more in looking at population health and being able to detect events early on there. But I do think that environmental detection has a role. certainly in the military space, much more of a role than in the civilian space. And I think what's really needed is a focused program on bringing new technology, which technology in this space has been emerging very rapidly, and things are possible today that were not even conceivable 15 years ago, and so I think we have the ability to take some of that new technology and move it into a system that actually works and meets our needs. That one of the problems is there have been several attempts by the Department of Homeland Security to do that, and for a variety of reasons, they haven't gone anywhere. But one of them is, again, when we operate in the constraints of how the government often focuses in procuring new systems, we end up with systems that are automatically 10 years old and obsolete by the time we get them out. So we're now in the era of the iPhone 10, and we're still using a flip phone.
Donna.
I wanted to follow up on that because I was intrigued by, I think I heard your suggestion that we might take some of this outside of the government into the private sector to make it more nimble. And obviously, the problem with government bureaucracy is also a problem with congressional jurisdiction. I mean, the reason we have the fragmented system is because everybody's funded in a different way and it's hard to coordinate it. So let me pursue that. How are you thinking about that?
Sure, great question, and I think there's many different ways to approach that. I don't necessarily think that we need to completely punt to the private sector and not have strategic direction, from the federal government involved in that. But I think there are other approaches that potentially could work. So historically, in the nuclear and national security spaces, many of these large, technically complex problems were given to what eventually became national laboratories. So public-private partnerships with universities and other entities to create the national lab system we have now that was instrumental in developing many of our strategic nuclear technologies and also in later overcoming our decision to limit testing and to essentially model nuclear weapons testing and degradation completely in silico using computers. That type of approach is something I think that we could look at. The other thing is that other models of public-private partnership where we tried to spur innovation, I think Semitech is a great example. So that was a partnership between the U.S. government, but really mostly with the semiconductor industry, looking at foreign competition that was really beating the pants off the semiconductor industry for a while. And what they did is came together, as an industry and created a non-competitive space that was in part sponsored by the government to create an opportunity for them to grow together and to move U.S. semiconductor technology back to the forefront. Those types of novel approaches, I think, could be looked at in this space as well.
Tom?
Thank you, Joe. You both have very articulately talked about the extraordinary challenges we face in addressing the threat organizationally in the government. And I've always wondered to what degree that challenge is a definitional tension between health and security. If it's natural, it seems like it's always viewed on the health side. If it's intentional, it's viewed on the security side. And therein lies the challenge as we look at threats generically on how we address this problem organizationally. That definitional tension is one that keeps us from resolving many of the needs we have for simplification and the complex bureaucracy, because we're trying to cover all the bases, but we have two very distinct kinds of threats that really aren't addressed in part because of the definitional tension. How would you address that?
Well, I think it's beyond definitional. I think it's systemic. I mean, I think that you have in the health side, you have an entire education system that prepares people for health-related activities, and then you have a complete educational system that prepares people for national security challenges. And then there's this gap between the two. And we've looked at how, we've brought a number of people together to cross over those two fields, but you really need, I think, something at the apex of the U.S. government that tries to, I wouldn't say, streamline them, but somehow better integrate, at least at the fringes, what those two communities are doing. So, for example, well, there is a little bit of infectious disease surveillance going on by DoD, but most of that infectious disease surveillance is going on in the health sector. Why is DoD concerned about it? Because they're concerned about what it means from a national security standpoint. So I think that there's definitional, I think there's institutional, and then I think there's objective challenges. What are our goals for each of these communities that are very difficult to overcome? Part of it is, I think, sensitizing the different communities to the needs and the operational structure of the other side. They operate in a completely different way. I'm not a doctor, but I have someone on our board, Dr. Harvey Rubin from the University of Pennsylvania, who is one of the governor, who's really, really knowledgeable about this crossover issue between security and the public health system and infectious disease. And but and I think James obviously just demonstrated his extreme knowledge about this. But it's a small group of people, and I think that's what needs to grow. I think that community where the rubber is, where the two communities are being held back from each other. I think that is one place where this can begin to grow.
Ken, do you have a question?
Thank you. Just a quick one. Thank you for your presentation. It's good to see you again. Question for you, Dr. Lawler. You said at some point that that maybe we've ceded too much authority from the private sector to government in this space. Just wanted to follow on and see what lurked beneath that comment.
Well, only that, and not only the private sector, but to a large extent the nonprofit and philanthropic sector as well. So I think there's an opportunity for others to partner with the federal government to take advantage of where those entities can be more creative and potentially more responsive. And so, again, it wasn't necessarily to say that the federal government shouldn't have a central role. They should, but I'm not sure that they should own every part of the national biodefense enterprise.
Okay, fair enough. Thank you.
Dr. Luongo, let me ask this question. I take it from your testimony that you were not surprised when General Dunford said, as Governor Rich quoted, that one of the reasons we attacked that hit with missiles that scientific research center in Syria was that we concluded that they were developing biological weapons there. And that I take it, therefore, that it's reasonable to foresee the expansion of biological weapons capacity worldwide. Am I right about that?
Yeah, I think this is, I think that James just gave a great example of high school students working on gene editing that wasn't available 15 years ago. So if that's happening in the United States high school, what's happening at a sophisticated level in countries that are competitors and enemies of the United States? So I just, for one example, leaving aside Syria for the moment, Russia has probably the largest biological weapons complex in the world during the Cold War. After the fall of the wall, almost all of those facilities were sold off. They're not controlled by the government, or they're quasi-controlled by the government, but there's also private sector, whatever constitutes private sector in Russia these days, involvement in those facilities, and it's totally opaque. I mean, we once had a window into what was going on in there, and now we don't have a window into what's going on.
But you have no doubt that the Russians have an active biological weapons program.
I have no doubt that the Russians have an active biological program that has weapons potential. I couldn't say, given the lack of access, that it's actually a biological weapons
Let me ask
program.
this final question, which is, looked at this way, it's surprising, at least to me, particularly when you think of the anthrax attacks that followed on 9/11, that we haven't had a significant biological terrorist attack, our nation state, against our country. And interested in hearing your theory or analysis about why we haven't, and whether you think it's likely, or we have to assume that there will be an attack sometime in the near or midterm future.
Well, let me start with an anecdote from the nuclear world, because the kind of analogous thing is, if radiological terrorism is so easy because, there are blood irradiators in private hospitals, people ask all the time, why hasn't radiological terrorism occurred?
Right.
So I go around the world and I ask people from different governments and say, why hasn't radiological terrorism occurred? And they say, we don't know. So, I do think that I think it's the same with bio. I think there's a threshold issue that once crossed, I think opens a real Pandora's box. And I think an intentional biological attack, not a non-state actor, but a state intentional biological act, is a serious piece of business. And I think that that's a crossing of a threshold that we haven't seen yet. And I think there's some reticence to do that. The terrorist issue could just be that they haven't mastered yet the ability to make the pathogen robust enough. But I have no doubt, absolutely seriously, that this is a continuing and growing threat. And as technology, not just biology, but as technology in collaboration with all of these other technological advances move forward, I think we're facing a more serious challenge, and we're doing less about it. And that's a mismatch I frankly don't understand.
Well said. Governor Ridge.
If I might, to follow up on that, Ken, you mentioned that there are very few global rules relative to synthetic biology, and the panel and you and everybody in this space says, but synthetic biology is accelerating rapidly, and to the extent that we don't know, but we presume those our foes are very much involved in that as well. So there are few global rules. Is there any reason to believe, even if we had global rules and people signed the convention, that anybody would live by the rules?
Well, we would.
Well, that's
I mean, this is the old arms control question.
So if you think it's developing at a rapid pace in laboratories of our foes, you agree by and large that conventions will be signed and then ignored. Where do we focus our efforts in this country? Is it DOD? Is it DHS? Collaboration between the public and the private sector, accepting this now not as a medical issue, synthetic biology, but as a national defense issue? And is there enough research going on, both of you, in this space to build out defense mechanisms?
I would start, frankly, with the intelligence community, because I think that's a community that I think is understaffed for this challenge, and that's where the information about what's going on in the dark corners is going to come from. And I wouldn't do it just necessarily, I know this is difficult to do, but I wouldn't do it necessarily just as a U.S. intelligence focus. I think it has to be done with allies and with friends and even with quasi-friends, to try and sensitize those communities to the challenge that's out there. The second thing I would say is we have tried through the Biological Weapon Convention review conferences to talk a little bit more about what's happening in these biological spaces. But don't expect, as former members of Congress and high-level politicians, don't expect diplomats or people that deal with, policy issues to be able to grapple with the details of the technology, because it's a very difficult thing to do when you've got a lot of other things on your plate and you've got people in the review conferences that don't want to do what it is that you want to do. So I think we need to find, and I actually don't know off the top of my head who the right community in the United States government is to have this regularized conversation, but I know that somebody needs to be having it, because doing it in the BWC review convention every 5 years that's Stone Age. What happens in 5 years in bio is light years.
Dr. Lawler, you want to add or have the last word?
Sure, I will address that question as well. I think that I'm not sure it's possible to externally constrain and limit scientific progress in that way, and I'm not sure it's necessarily advisable. I think one issue that needs to be addressed is how the scientific community regulates itself in that space. I think that happened. Certainly, there's precedent for that in physics, in the advent of atomic weapons research. There's also precedent for that in biology, in early on, looking at early days of genetic engineering. So there's no simple answer for that, but I think that has to be one of the foundational principles. I think the other thing is, again, if we can't slow it down, if we can't constrain it, we're going to have to outpace it with our defensive research. And that's something where I think we have not focused, and we need to spend a lot more effort.
Well, thanks to both of you for not only for your excellent testimony, which is really helpful to us, but for your ongoing work in this area, and I hope we'll continue to stay in touch. We've reached that great point in the agenda where it says break to gather lunch. Asha or Patty, do you want to tell people what they're supposed to do, or is it self-evident?